Hi, I'm Jacob Campbell, a Medicare Advisor here in Oklahoma City, and welcome to Medicare IQ. I created Medicare IQ for one simple reason: to take Medicare topics that can feel complicated or overwhelming and break them down into simple, easy to understand information. You shouldn't have to know all the insurance terminology just to understand how Medicare works. So, with Medicare IQ, I want to help you understand how Medicare works, the choices you may have to make, and the questions you should be asking so you can feel more informed when it's time to make decisions about your coverage. And today, we're talking about something almost everyone going into Medicare needs to understand, and that is prescription drug coverage, which is also known as Medicare Part D. Now, here's the first thing you need to know: original Medicare does not cover the vast majority of prescriptions you pick up at the pharmacy. Now, that's where your Medicare Part D comes in. And even if you don't take any medications right now, Part D is something you don't want to overlook. So let's make Medicare Part D simple. Now, when people say original Medicare, they're only talking about Medicare Part A and Part B. Part A mainly helps cover your hospital care, and Part B mainly helps cover your doctors and outpatient medical care. Part D is Medicare's prescription drug coverage, and it is separate from original Medicare. You can get Part D coverage in one of two common ways. You can purchase a standalone Part D prescription drug plan to go along with original Medicare, or you can get a prescription drug coverage plan through a Medicare Advantage plan that includes Part D coverage. Now, here's something that can be confusing. Medicare Part D is technically optional. Medicare doesn't require you to enroll in a Part D plan. But optional doesn't mean you should automatically skip it, especially just because you don't take any medications today. Because if you go 63 days or more without Part D or other credible prescription drug coverage after you're eligible for Medicare, you could have to pay a late enrollment penalty if you enroll later. And when I say credible coverage, I'm simply talking about other prescription drug coverage that Medicare considers good enough to take the place of Part D. Now, here's what makes a late enrollment penalty so important. It isn't necessarily a one-time fee. That penalty can be added to your monthly Part D premium for as long as you have Medicare drug coverage. That could mean the rest of your life. And generally, the longer you go without credible prescription drug coverage, the larger that penalty can become. So you might be healthy when you first get Medicare and think, hey, I don't take any prescriptions. Why would I pay for drug coverage? But your health can change. 5 years from now, you could suddenly need medication that costs hundreds or even thousands of dollars. At that point, you may not be able to simply just go in and sign up for a Part D plan immediately. You may have to wait for an appropriate enrollment period. And when you do enroll, you would be facing a late enrollment penalty. So while Part D may technically be optional, choosing to go without prescription drug coverage can have long-lasting consequences. So now let's talk about the cost. Part D plans can have their own monthly premium. They can also have something called a deductible. Now, if you've never dealt with insurance before, don't let that word make it complicated. A deductible is simply an amount that you may have to pay towards prescriptions before your plan begins paying its share. Now, in 2026, a Medicare Part D plan can have a deductible of up to $615. But that does not mean every Part D plan has a $615 deductible. Some plans may have a lower deductible, some may have no deductible at all. And depending upon the plan, certain prescriptions may be covered before you've met the deductible. That's why it's important to understand how the deductible works with the medications you actually take. Now, here's another important number for 2026. $2,100. In 2026, there is a $2,100 annual out-of-pocket limit for covered Part D prescription drugs. Once you reach that limit, you pay $0 for your covered Part D prescriptions for the rest of that calendar year. Now, that can be an extremely important protection for someone who takes expensive medications, but there's one important distinction. That $2,100 limit applies specifically to your covered Part D prescription drugs. It does not mean that all of your Medicare healthcare expenses are limited to $2,100. We're talking specifically about Part D prescription drug costs. There are other deductibles and copays for your medical services that are separate from your prescription drug costs. Here's another thing I want you to remember. Not all Part D plans are the same, and the plan with the cheapest monthly premium isn't automatically the best plan for you. You start with the medications that you actually take. You want to know, does the plan cover your prescriptions? How much will your prescriptions cost? Does the deductible apply to your medications? And can you use the pharmacy that you prefer? Two people living right next door to each other could take completely different medications and need completely different Part D plans. That's why choosing prescription drug coverage should be based on your medications and your situation, not simply which plan has the lowest premium. So if you're new to Medicare, here are the 6 things I want you to remember about Medicare Part D. Number 1, original Medicare does not cover the majority of prescriptions you pick up at the pharmacy. Number 2, Part D is Medicare's prescription drug coverage. Number 3, you can get Part D prescription drug coverage in one of 2 ways: through a standalone Part D plan that works alongside original Medicare, or through a Medicare Advantage plan that includes prescription drug coverage. Number 4, in 2026, a Part D plan can have a deductible of up to $615, although some plans may have a lower deductible or no deductible. Number 5, in 2026, your annual out-of-pocket costs for Part D prescriptions are capped at $2,100. Once you reach that limit, you pay $0 for covered Part D prescriptions for the rest of that calendar year. And number 6, Part D may technically be optional, but going without it or other credible prescription drug coverage could result in late enrollment penalties that can follow you for as long as you have Medicare drug coverage. So even if you don't take prescriptions today, don't overlook Part D when you first become eligible for Medicare. The decision that you make today could affect what you pay years from now. Now, I know Medicare has a lot of moving parts, and Part D is just one piece of the puzzle. But the more you understand before you make your Medicare decisions, the better prepared you'll be to choose the coverage that fits your needs. And that's exactly why I created this channel, Medicare IQ, to give you straightforward information, explain Medicare clearly, and help you know what questions to ask. So if you're in the Oklahoma City area and you're getting close to Medicare, or you're already on Medicare and have questions about your coverage, reach out to me at 405-388-6611 or stop by my office at 9012 South Sooner Road in Oklahoma City. And remember, you don't have to become a Medicare expert. You just need to know enough to make an informed decision. I'll see you in the next Medicare IQ video.